Hi, hello everyone, and welcome to Brook's Breaking Barriers series for Sexual Health Week this year. So this is a series we're doing with staff who will be talking about barriers in sexual health and also barriers to sex education as well. My name is Francesca Fiennes and I'm an education and wellbeing specialist here at Brook. And today we're tackling the topic of access to health services. And I am here with Rachel, who I will let introduce herself to everybody as well.
Yep. Hi, everyone. My name is Rachel Gambling. I'm a health promotion specialist at Brook Southend, which essentially means that I go out and about and do outreach in the community, basically encouraging people to get tested, have safe sex, and just to open up conversations around people's sexual health knowledge and stuff.
Great. So you're working in Southend, and your title is health promotion specialist. So
Yeah.
How is that different maybe to those of us who are working in education or working in schools?
So a few years back, I did some work experience with Brook with an education and wellbeing specialist. And from like the week I was there, and from what I know from other people who work at Brook, such as yourself, education and wellbeing specialists tend to primarily go into schools or other places like colleges, etc., and provide relationships and sex education to young people. But they may also provide professionals training, such as the traffic light tool that we have. Personally, what I do, I don't go into schools as much. So I might do things like health promotion stalls, which would basically be, we set up a little stall maybe in like a local library, maybe at a local college, and then we would provide like information around sexual health and allow people to pick up free condoms from there. I might do something called point of care testing, which would essentially be, I'm running a drop-in clinic somewhere in the community that people can easily access, and it's a bit more discreet than going into, say, our clinic. And I would basically do a little finger prick test to test for HIV and syphilis, and the results for that would be instant. And I would also give them a chlamydia and gonorrhea self-test to do in the bathroom themselves, and then I would send it off for one at the end of the day. And then I also do stuff like going into community groups, so maybe groups that work with the homeless, maybe groups that work with sex workers, that work specifically with, say, like the members of the disabled community, the LGBT plus community, etc. But it's a very wide ranging job, and it's very fun and interesting to do.
Yeah, I was thinking as you are talking and telling us about all the different places that you go to, that obviously it's nice that we have this work going on in Essex, that if people can't maybe access the service typically, or maybe they don't access those services typically, that there's actually a lot of places that we can as professionals kind of meet people where they need to be met, versus maybe also not having things like the time off to go to clinics. That kind of leads really nicely into my next question for you, which is, what do we think the kind of main or overarching barriers that people who do need to access sexual health services face? So what are the kind of the predominant ones in the UK, let's say, at the moment?
So we're contracted in part to try and reach certain beneficiary groups. So that might be migrants who have come into the UK. They might struggle to access sexual health services, perhaps due to a very obvious barrier, might be language barriers, particularly so with refugees that might be coming into the country at the moment as well. So we might try and interact with like groups like that who interact and provide, say, like English lessons to those people. We would then perhaps offer, say, we perhaps go to them and say, hey, we can do some point of care testing with you, or we can just give a little talk and answer some questions about how they can access sexual health services. We would also perhaps go to a support group for sex workers, and we would try and keep that one very, very discreet, since it's a occupation that comes with a lot of stigma. So we would want to basically keep showing up to those kinds of places, just so we can establish a rapport with, say, women or men or anyone else that may be a sex worker, so they know that they can trust us, and that confidentiality is really high up our priority list.
Great. So I guess we've got kind of, cultural barriers, particularly language, and that's something that at Brook as I'm sure you know, we're trying to tackle, and particularly considering the translation of obviously sexual health terms. But I guess you've also mentioned the stigmas that some people might face, particularly those who maybe are sex workers, or those who maybe feel not traditionally represented by healthcare, or may have been excluded in terms of inequalities. I just wanted to ask, obviously how maybe you have a particular opinion on this based on your work, but about, I guess, structural or economic barriers that might exist in terms of access to health services, maybe your experience of that in your previous work or in your current role at Brook.
Yes, so at Brook, particularly Brook Southend. So Southend is a very, very diverse area now. You know, it's a very new city, and it has quite affluent areas, such as Lee, but then it also has areas that have perhaps more of a lower income, they have lower income populations, such as Westcliff. So when it comes to that, when it comes to people from lower income backgrounds, say they want to provide for their family, they have to go to the food bank and pick up food for their family and everything. We would then be there to provide them with any sexual health advice they might need.
Oh, that's a really good point to make, that obviously we may be making the assumptions that people do have time to go to a clinic, or that it would be everyone's kind of number one priority, and based on your life and your lifestyle. And also, I guess, if we're looking at under-resourced areas, or areas where there are other health inequalities, particularly, I guess, sexual health, people don't always have symptoms, so perhaps there's that kind of level of it's maybe not the number one priority. And also, I guess, if testing isn't commissioned online in that area, that at Brook we're providing that service that maybe is plugging some of those holes that do exist in terms of sexual health provision across the country. I love this idea of point of care testing and being able to kind of meet people in settings that are, maybe the more comfortable in terms of away from stigmas. Obviously, we know that we hear these stories of people having to wait outside clinics in really public spaces, which obviously can impact people's access to services. So obviously, I know that you're working in kind of an all-age service, but at Brook we're also doing, I guess, a lot of work, or predominantly most of our work has been with young people. So I wanted to ask you, what are maybe the main barriers that you might experience specifically for, let's say, under 25s accessing sexual health services at the moment?
So under 25s, there tends to be a lot of concern about, oh, what if my parents find out about this? So when they come up to your health promotion stall and they're asking about signing up for the C card scheme, we have to ask them details like their name, and we have to know their postcode, because the C card is dependent on which area you're in. And obviously with the C card here, you have to have a Southend postcode in order to access it. But we allow college students, even if they don't live within the area, to just use the college postcode and then access it that way. So when we ask them for their postcode, they go, oh my God, is anything going to get sent to my house? Like, I'm really worried my parents going to find out. And it's like, no. Nothing will get sent to your house. This is just so, we know when you're picking up condoms and everything, and we can safeguard you if that issue ever comes up at all.
From my work, I work mainly in Hounslow, West London, and we sometimes see things like promotion can be an issue, that people just don't know the services exist. And also sometimes that schools maybe aren't linked up with sexual health services that are in areas. So if you are anywhere in the UK watching this, please, as a school or a youth club or another setting that you do see young people in, knowing the local services is very useful. Sometimes we see that when people do engage in sexual health services, that's when we can tell them, obviously, and we want that to be unanimous across different services that young people use as well. Great. And in terms of, let's say I'm in Southend, or I'm living somewhere across the UK, and I've never engaged with sexual health services, what is the best way that I could do that as a service user?
So just a little promo for Brook. There's a little find a service tool on the website. So if you want to find out if there's a Brook service or any other sexual health service in the area you're in, you can use that.
Yeah, so great. So we've got find a service tool, and I guess also the internet. Obviously you can go to and you can also signpost young people to our Instagram, which will be available in the link underneath, and anything else we've spoken about underneath this video. So in terms of maybe tips for making services more accessible. So let's say, irregardless of commissioning or new contracts, like what could, let's say I'm a teacher, let's say, for example, in Southend, what could I do in my daily role or daily life to make sexual health more accessible for people, let's say young people that I'm teaching?
So if you're a teacher, I would probably recommend understanding who exactly is providing the sexual health service in your area. So in particular with Southend, Southend is within the county of Essex, but the Essex and Southend services are different. So that's where things can get a little bit tricky at times. So if you do live in Southend, if you're a teacher in Southend, please look specifically for the Southend Sexual Health Service. We can provide you with, say, a health promotion stall at your school. We would also perhaps be able to come in and chat to some of the pupils, perhaps one of your classes, and we could talk to them about a particular topic, whether that's to do with consent and the law, or just generally accessing sexual health services.
Great, yeah. And as you've been speaking, I've been thinking a lot about what I guess needs-based work looks like, and knowing who you're working with. And sometimes we have these assumptions like, oh yeah, but sex or sex education is very commonly spoken about, but sometimes we need to really reflect on what some of those barriers might be, and also things like access to training, access to just knowledge of local services as well. So I think that is a nice kind of point for us to end on. So your main messaging being that's really obviously important to think about accessing people where they are, where's more convenient for them, and also thinking about, are there ways in which we can be maybe more creative with service provision as well. So thank you very much, Rachel, for joining me technically this afternoon. So obviously, if you do need any access to other resources from Brook, we recommend going to our website, which is brook.org.uk, and obviously please read our professionals blogs. I'm not sure if you've written one or people on your team have, but those are really, really useful to find out a bit more about our work here at Brook. And also make sure to check out the other videos in this series. We all work together to think about topics, and we'd really recommend checking out the rest of those. So thank you, everyone. Enjoy your day wherever you're watching this.